Good evening and welcome to this edition of Tok Piksa. We begin tonight's program with the Goroka General Hospital Saga. Last Monday, allegations were made of 400 workers walking off their jobs, stirring up public concern and criticism. Much of the blame was leveled at the Eastern Highlands Provincial Health Authority, who have faced allegations of mismanagement and underfunding to the Goroka Hospital. The cause of the alleged mass resignation had been complaints by workers, which included poor working conditions and health service delivery. No hospital-grade detergents and gloves were amongst the claims. But recently appointed Provincial Health Authority CEO Lilian Siwi dismissed the claims of the mass walkout. She said the issues at the hospital were more administrative. MTV's Bethany Harriman looks at the Goroka General Hospital Saga and the overall struggle of the Eastern Highlands Health Authority.
The Goroka Hospital saga began before allegations on Monday that workers walked off their jobs. The workers had handed in mass resignations in early December, backed by unions within the hospital. It comes against a backlog of concerns raised by workers that include the lack of equipment and medicine to carry out their jobs. Much of the blame has been leveled on the Eastern Highlands Provincial Health Authority management's inability to provide funding for the Goroka Hospital.
In my position, the funds were readily available. So whenever the nurses and the doctors needed it, it was there to be used so that efficient patient care and quality patient care can be provided. But with the PHA arrangement or Provincial Health Authorities arrangement, even though it's a very good arrangement, what the PHA management has done has been that they haven't provided the financial support that the hospital needed to run.
He has been pointing his finger at us to tell us that these are things that we have not bought. But he had the full financial power of 20,000 to be able to buy those things.
Earlier this week, Eastern Highlands Provincial Health Authority CEO Lilian Siwi explained that the underlying problems are administrative and there is no mass resignation. She also reaffirmed that the termination of 5 staff, including the hospital's manager, still stands because it was sanctioned by the board. But the Health Minister, Michael Malabag, has suspended the Provincial Health Authority board. He says an independent commission of inquiry will investigate the board in 2 weeks.
Was a bigger organization with its funding.
On Wednesday, terminated hospital manager Dr. Francis Wandi explained that workers walked out from their jobs after frustration over many years of complaining. He says the hospital is in disarray because there is no funding and proper management structures haven't been updated.
That doesn't mean that with the new arrangement there could not be any funding. What it needed from the management and what it needed from the board of the Provincial Health Authority in Eastern Highlands was to have funds readily made available.
But on Wednesday, operations at the Goroka Hospital carried on as normal. The Provincial Health Authority management on Tuesday maintained that the hospital continues to function and 400 workers haven't walked off their jobs. It comes after allegations were made on Monday that the hospital was closed.
Until today, I have no idea what the union grievances are. Individual unions have not reported to me that they have a grievance that PHA has not attended to.
For me as the governor, I see that termination is too harsh. Termination is too harsh to the...
Eastern Highlands Governor Julie Soso has made a formal request to the CEO to uplift the termination of the 5 senior staff members. Both Governor Soso and Lilian Siwi have backed the move by Health Minister Michael Malabag to send a commission of inquiry to investigate the board in 2 weeks.
It's the same issue since Malkela Smith was still the governor, and it's continuing on into now me being the governor now. So it's all about the same thing, talking about mismanagement, and there's no simple materials like hand gloves or detergents or proper detergents to maintain the hospital.
I welcome that because it is actually going to give a balanced view on the actions that we've taken and what the public have been informed. And that's what I said to the to the acting secretary that actually rang me. I said I welcome that.
The Eastern Highlands Health Authority has its problems, but the most successful provincial health authority setup has been that of the Western Highlands Province. The Western Highlands Health Authority's success has been attributed to its management and board.
Do such a way that our public can trust our services. Otherwise, because they come here, they can see somebody here. They go some other place or go on an man, so they will, because of the road systems are good, people will tend to get on a PMV and come right down to here. And so we are saying, no. You don't necessarily have to come to us. And that's also part of the health reform and the provincial authority work, is that we must take the services closest to our people.
The man behind the Western Highlands Provincial Health Authority's success, Dr. James Kintwa, has been the CEO since the establishment in 2011.
I'm optimistic, and I've challenged our staff when I met with them, I think several weeks or months ago. If we don't see these things happen, if we don't see the indicators getting better, then there's no point in us doing this work, because ultimately we want to see our indicators improving, health status indicators improving for our people.
But there are other views on the health authority system. Lays Angao Memorial Hospital CEO Dr. Jim Abrams feels that the health authority is suited for certain provinces only. He explains that the concept can't be forced on all other provinces. The purpose of the Provincial Health Authority is to bring basic health services right to the rural areas. 3 provinces took part in the pilot program: the Western Highlands, Eastern Highlands and Milne Bay Province. The Western Highlands Provincial Health Authority has been the more successful. A lot of things has contributed to its success, but what stands out the most is the stability in its board and management. It's something that needs to happen for the Eastern Highlands Provincial Health Authority.
You're watching Tok Piksa. Nawai district in the Morobeh province has seen infrastructure developments in the shape of road projects extending to villages previously inaccessible by vehicles. Recently, the people of Nawai received road services from the government's public investment program. The new road cuts through the mountainous regions of Nawai district, and it now provides the Nawai people the accessibility to transport cash crops and garden produce to lay markets more efficiently.
Nawai district is located in the highlands of Morobeh. It is a landlocked region and has a similar environment to the highlands. The people grow vegetables like onions and other crops that grow in the highlands. Many of its villages are scattered all over these rugged mountains and are only accessible by foot. Nawai district is also a coffee-growing region, contributing about 1/3 of the total coffee production of Morobeh. Much of these fresh produce and cash crops don't make it to the urban markets in Leh because of the distance and poor road network that has plagued these people for many years. The people continue to use the age-old method of navigating through the jungles to carry their garden produce, coffee bags, and sick people that walk for several hours before reaching the road.
One pla bag coffee and 2 pla man bas Karim na Karim. Karim na igo go on top of the mountain, maloloken, Wakabautigo kamablo marulu place sit down drink waraken brukim narapla waraken wakabautigo go marulu ken no namel hap sit down marulu ken now mi plaza go kamablo rotka.
The nearest government outstation is at Buana. It is a day walk from here. Basic services have been few and far between in recent years in this part of the district.
Mi plaol meriet sabe ka walking bed lo mambu put him tupla mambu lo side now put him bed igo namer now put him mama igat bel igo antap lo desla bed now mi plaza karim na wakabaut lo desla mountain igo antap.
Like any other rural area in the country, a good road would mean adequate service delivery into this area. This will be the first time that these mountain people will see a good road that will be built into their area, which was once isolated and forgotten.
There's a lot by Igo Kamablo, Sakarang lot, Gewak Sakarang lot by Kamap next year or this year by Plakam looking Plakenanta.
This road marks the start of a road construction that will cut through these ridges, linking villages further up the mountains. The road project was funded through the government's public investment program, costing 5 million kina. The road will stretch for about 22 kilometers, reaching several other villages on the other side of these mountains.
We are more focused on our five policies for the government. One of them is infrastructure. Now, our people, we see the lights in town, in Ley, but my goodness, there's no roads coming. That's why when I was elected, I want the road system to be, going to the villages, and one of them is here, coming here. And this is, please, I'm not in the nation, and my government, please, give me more money.
Although the new road may have given some hint of political will in this part of the province, the people still remain skeptical about the national government basic service delivery mechanism.
That's a road hard. Na inaplo ambulance kam kisimol na igo no ga road to. Ose na trangol mama stop emol walk lo make it this la walk lo help him mama lo die no can come up. Nupla life must stop good na must come up good.
All these are big challenges facing first-time MP Giswat Siniwin, who ran for office in the 2012 national elections. The veteran teacher cum politician was elected into office with promises of better roads infrastructures and upgrade of social well-being of the Nuai people.
You have seen this one part of the classic part of permanent building. You go up there, it's all permanent building. How they carry it? From the junction of the road or the Magong, they carry them up. So when the road comes in, it will give access to, get things to improve their standard of living.
Almost make a good road blow mipla, na mipla mama must sit down good, na mipla must carab good locar, na mipla must go to market. Emos in a plant heavy mipla walk lo bungim inside the place, no got road.
Nawa is slowly seeing some changes. For the next 2 years, the district expects to see more changes in the areas of health and education once this road is complete.
You're watching Tok Piksa. Police operations in PNG are usually manual. Officers physically inspect and carry out their duties with little consideration of threats of explosives. But with the use of trained police dogs, the risk can be minimized and operations can be sped up. In the nation's capital, the dog unit is an outstanding unit in the Royal PNG Constabulary that specializes in dog handling and training. With less than 50 officers and only 16 dogs, this unit has recorded remarkable successes with the aid of trained dogs. In our final story tonight, Quinton Nalomp features a police dog named Sheldon. Sheldon is the only firearms and explosive sniffer dog in the Royal Papua New Guinea Constabulary.
One blood doctor saw me black lo country na lo police post. Even all army all in got dog lo sniffing all explosives. But me black police to saw me black lo country now. I'm just like one blood doctor son. Name blog I'm Sheldon.
We got three types of dogs. It's the general purpose dogs, the firearms and explosive dogs, and a drug dog.
Sheldon is no ordinary dog. He's the only dog that plays a crucial role in protecting the citizens of PNG. Sheldon has special skills that distinguish him from other trained police dogs. He's a good explosive sniffer dog, and he can even let his partner, Sergeant Dominic Nassam, know if there is a gun hidden in a vehicle, in a backyard, or concealed deep in a container. His special sense of smell can't be tricked by other smells or things used to cover up explosives.
Anything is explosives or bomb or gunpowder or cartridge or bullet, gun, even if it's factory made or homemade, I'm still indicating, I'm talking you. So I'm trained on any type of commercial or military, I can still sniff him and indicate him.
For a human being to track and to trace, it takes a little bit a while. But for a dog, if you suspect anything and you move in on spot with your dog, a trained dog who can sniff, example for an explosive dog or a drug dog, on spot we can sniff and that's it. Apprehend the suspect and, deal with him, police process.
Sheldon and Sergeant Nassam work exclusively as a team from start to finish, which makes it easy to understand the close relationship they have. Only 6 years old, this friendly-looking Labrador can sniff firearms and explosives using his nose, which is very sensitive. Sheldon is the only dog in the Papua New Guinea Royal Constabulary that specializes in firearms and explosive sniffing.
Now, the country, one that me specialist in display. Work firearms and explosive detection. I'm long. This little dog too, I'm one play. Mitla one yet.
Previously, they were 2, but unfortunately, one passed away in December last year. Being the only firearms and explosive sniffer dog now serving the entire length and breadth of this country, Sheldon has a huge responsibility to ensure the citizens of PNG are safe from explosives is huge.
So I need 3 more dogs to break this one up. So I'm looking at 4 to have firearms and explosives. This is to do with firearms, explosives.
To keep him healthy and physically fit, he receives the best treatment and training from his partner, Sergeant Nassam. He undergoes medical checks at the RSPCA clinic every month. Last Thursday, when MTV visited the Bomana Dog Unit compound, Sheldon and his partner put up a demonstration. Sheldon demonstrated how he carries out his job, and when he detects an explosive, he sits, indicating that he has found something. Sheldon's special sense of smell can detect up to 9 different types of explosives, including grenades. He and his partner were trained in Brisbane, Australia for 6 months and graduated with recognized Well Standard certificate. But now, concerns have been raised by his unit bosses for the government to purchase a few more Labrador sniffer dogs.
We did him sample more dogs, all kind of dogs, all firearms explosive detection dogs. Not in Mosby alone, but not all major centers like Ley, maybe islands and New Guinea Islands. And we can put him all on display location. And also along our border areas like.
So it's my appeal to, the police management and maybe our ministers look at this sort of situation and focus in the next 15 years to come, in the next 10 years to come, in the next 20 years to come. We should be prepared by now. By now, we should be prepared. And be mindful that we have a very important event that is going to take place in 2018. So, I think it's about time we start to gear up, get ourselves prepared and ready before time catches up. And, some people who have those brains work out and then we lose it again.
This breed is used in explosive sniffing because they are friendly, small in size, and able to move over and under any obstacles.
Left, right, left, 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 right, left, right, push!
And that story of Sheldon, the sniffer dog, ends Tok Piksa for tonight. If you missed anything on tonight's show, you can catch the replay on Wednesday evening. And until we do this again next Sunday, I'm Neville Choi. Good night.